Let's get the acting chief public health officer, Chima Mbakwem. Can you let him in? He's knocking. All right. It's 8:24. Chima, thank you for joining us. Good morning.
Unmute Chima.
Unmute. Unmute. Yeah.
Good morning.
Good morning.
Good morning.
All right, big morning for you guys.
Morning.
Morning. I guess Chima, let's just go ahead and start. If you could provide any more information on the recent positives that we've seen this week, where they're coming from, who they're connected with, and then we'll just go down the line from there.
So most of the cases are still family cases. We just have only 3 travel-related cases, and most of the others are household transmissions. So it's a small Mother's Day family gathering, and then we just had a few cases from that. But if you're looking at our cases over the past 2 weeks, 2 weeks, it's been consistently steady between 0 to 10, which is not too bad because most of them are family close contacts.
Did you say Mother's Day gathering?
Yes.
Can you give us more info on that? So what happened and how many cases resulted from that gathering?
No, it's just a family, like a family meal, not like not like you have people. Yeah, just a family meal. Yeah, but it was traced to that particular day.
Okay.
Yeah.
And that was it, because I remember when Mother's Day happened, there were some we had on the show who said, "Oh, we'd wait a couple weeks and see what happened." So was that all that happened?
Yeah, that was all. So I think people paid attention and they were more careful. And Mother's Day is very personal, so people spend time with their family.
Right.
Are any of these recent positive cases that we have been seeing on the daily, have they been vaccinated, non-vaccinated, partially vaccinated?
Yes, only 9 of the positive cases were fully vaccinated. All the others were not fully vaccinated.
So out of all the recent cases, what, in this past week that were full?
Yeah, with the ones I have in front of me is only 9 cases from the 10th to the 19th of May.
So from the 10th through the 19th of May, if I go back and do the math, and whatever number of positive cases that was, 9 of them were fully vaccinated individuals.
Yes.
Wow. Were they in the young age groups?
I don't have
Are
that
they
breakdown
older?
right here, but I know that they were all asymptomatic.
Asymptomatic. Okay.
So have we totally closed out all of the Subaki clusters?
Yes, we've not had any cases that are directly related to those clusters in the recent time.
How have the operations been going over at the airport with the vaccination verifications of returning Guam residents that were fully vaccinated here?
Yeah, it's been smooth because, like I said earlier on, we have the WebIZ at the airport. So individuals who were vaccinated on Guam are actually able to do their second verification at the airport. Right. So that is the advantage. But for those that are coming from other places that are not Guam, that vaccinated in other places that are not Guam, then they need to have that secondary vaccination proof on hand, or they go to the QFAC and then help us, reach out to whoever they had the vaccination from, so that we can get some form of second proof for us to let them go into the community.
Mm-hmm. And what about the vaccination verification? The call center was stood up at UOG. And this is just for people that were vaccinated on Guam, are leaving the island, and if they're going to another locale or jurisdiction that requires a secondary form of verification, that's where you need it, right? When you would need that. I'm not sure.
Yes,
Go ahead.
yeah, but I don't think other jurisdictions are asking for vaccine records for entry. I think we're the only ones that are actually doing it for now.
Okay, so then why would we need the vaccination verification printout then?
Why do we need the?
In the JIC it said that, okay, this vaccination verification you call UOG, you call public health, you only need this if you are going to another jurisdiction where they require this secondary form of vaccine verification. And I'm just wondering where exactly are these places that you're aware of?
Right now, I don't know of any destination that is requesting for a second form of verification offhand, but for Guam, what it is for if you're coming back to Guam as a Guam resident, you need that second form of verification to get through at the airport. That is the intent. And also having a secondary form of verification for your vaccine record. So you have your CDC card, and then you have the WebIZ printout, which is your official vaccine record that has all your vaccines. And COVID, if you had the COVID vaccine, it will also be in that record.
Okay, so does this mean that the operations over at the airport, where public health has the 5 computer stations, is that only temporary?
No, it won't be temporary because for now, we are looking at other ways to make it easy. But right now we have people that are permanently deployed there to make sure that the system is smooth, while we look at better ways to do it, or more efficient way, like more innovations. Let me put it that way.
Mm-hmm. So eventually, then, we do need to have this vaccination printout.
Yes.
Eventually, okay.
But so the advantage for the Guam residents, and that is what I discussed with the director yesterday, and he was very clear in what he wanted us to do, is having the WebIZ on site at the airport. The advantage is that if you have been vaccinated on Guam, the WebIZ has your official record. So if you're coming into Guam and maybe you lose your vaccine card or you don't have a second form of verification, that can be done at the airport. So it's an authentication process to say, we have the record of everyone who has been vaccinated on Guam. So if we need to authenticate the fact that you're that individual, the system is there for us to just go in, and it takes less than 2 minutes for us to check your name against your ID card, your passport, and then if that's verified, then we'll let you bypass quarantine at the government queue.
Mm-hmm. No, but what I'm asking is public health only going to be up there temporarily, or is it going to be a permanent thing now, where we're going to have public health staff at the airport, so that when people who are fully vaccinated, were vaccinated on Guam, and they don't have this printout, it's okay because public health is there, and they could type on the computer. You're good.
Yeah, that's what I explained. We're going to be there as long as we need to be there, because these guidances keep changing.
Mm-hmm.
Maybe at some point there might be some other form of entry requirement, but right now that is the immunization. We're going to have a team out there to ensure that people who are vaccinated are verified and they come. So we will have the team there.
Mm-hmm.
Like I said, I think last week we've actually trained 20 individuals to man those computers at the airport.
Okay, but it's a good idea. Go ahead and get that printed vaccine verification.
Yes,
all right.
But if you can't get it, and the challenge we're having is people who are traveling in July, actually coming to ask for their printout.
Right.
When you have people who are also traveling tomorrow asking for that. So that's why we have this backlog, and the phones are ringing off the hook. The emails are coming nonstop. But I had, like I said, I had discussed with the director yesterday, and we were trying to put out some form of clarification, maybe later today, for Guam residents to explain further how, we can make it easy for the returning resident. So we are taking we're taking all that into, we're really taking it into heart, to address those situations.
Chima, so what's the plan going forward for the quarantine and the isolation facilities? Yes.
Yeah, how many people are in the quarantine right now?
I don't have my daily count yet because I get a daily count maybe like 10 a.m. because you have people arriving last night, they have to process them. You have flights coming in by 4 a.m. So we have a cutoff time when we release the people from the previous day and then do a head count. So that number I can't give it to you right now. But we've had a considerable number of people bypass quarantine straight home because of vaccination. So the number is a little lower than it used to be. But we still have people who are not vaccinated. Like the flights coming in from the Philippines, they were all on the night of the 15th. I was at the airport by 4 a.m. when the initial flight arrived. Everybody on that flight went straight to quarantine because they don't have the FDA vaccination, So, but the Hawaii flight, we had a number of people leave the airport by 7 p.m. that day straight home.
So Chima, they're saying that they're going to put out a bid for maybe like a combined quarantine ISO fac, but definitely something smaller. How much smaller are we going to go if you're saying that there are whole flights that are getting quarantined?
So it depends on the number of people on the flight too. So the flights are like 60 people. Like the flights from the Philippines. The heavy flights are like 120 to 150, I think, and then the smaller flights are like 60.
Chima, do we need 3 hotels?
3 hotels for what?
2 for QFAC, 1 for ISOFAC. Do we need 3 hotels?
No, it depends on what you need them for. Are you asking if we
do we
have
need them
increased
to,
number
do
of
we,
cases?
Do we still need 2 hotels for a quarantine facility?
2 hotels for...
She's just trying to say, Chima, if we're bypassing quarantine to the tune of hundreds a week, is it still sustainable, justifiable for us to have so many different quarantine and ISOFACs? We got the one ISOFAC at the Bayview, then we got the Dusit Beach, and then we got the Dusitani. So Sabrina's just asking if we really need all that, given that we've instituted this new bypass quarantine, go straight home if you're fully vaccinated.
So this is, this is day 4, so we actually have to look at our data because, before we're having 600 passengers, at every given time in the QFAC, between 600 to 1,000 passengers. So right now we need to look at our data for at least the next week or 2 to be able to have a justifiable data for us to make decisions. So right now it might be too early for me to make a call, about having 1 quarantine. But I think we only have 1 quarantine site. So it's actually the Dusit. The Dusitani is an overflow. So when we have huge numbers, it's an overflow to the other hotel. But basically, it's 1 hotel that we're using as a quarantine.
How many people are in the ISOFAC do you know offhand from maybe yesterday's count?
No, I have to wait. Like I told you, there's a cutoff time for me to get that information.
Okay. Is it like 10 or 20 or?
If If you can give me a second, I can give you that information right now.
Okay.
The information right now. I don't want to give. I just don't want to. I don't want to throw out numbers.
Of course. I know when we talked to Janelle, I think one of the last times we asked her about it, there was like 3 people in the whole Bayview Hotel. Must feel like The Shining.
3 people and a whole lot of bugs.
Yeah, they got the bed bugs, keeping them company. Sorry, Chima. Don't take it personal.
An assumption?
No, there's a video. Yeah, it's true.
Yeah.
We saw it. Hello, it's a video.
Janela thought.
No,
How long ago was this video?
it was a little bit. Yeah,
No,
it was like what, earlier this year.
And the thing is, we talked about that months ago, and we're still talking about, this whole combination of isolation quarantine facility.
Right.
So I think the reason for the isolation facility is something that we cannot just throw away because of the kind of community that we live in. We have all these multi-generational families, and we need to make sure that people who are positive are not at home with individuals who are not, so that we cut off transmission as early as possible.
Right. No, Chima, I'm not saying, we don't need an isolation facility. We don't need a quarantine facility. I'm just saying that we're paying for rooms that aren't even occupied. And we got like a whole hotel. And at the time when we had interviewed Janela months back, it was even less than a handful of people staying in the hotel, or even maybe less than 2 handfuls.
And we're not really saying anything,
Yeah.
but Janela and I think a few other people who have come on the show have indicated that we were going to get a smaller ISO fac. So we're not making any judgment
and it
call.
was even during an oversight hearing with public health with Speaker Teresa Lai, and she was just on yesterday saying, it's been a couple months since it was brought up, and she doesn't want to have to call public health into another oversight hearing, but she hasn't heard any updates after being provided the initial update that they were going to possibly combine the quarantine and isolation facility, but definitely downsize it.
Yeah, that's why we're asking.
Yeah.
Yeah, I think we actually so I think we have to look at the facts here, right? It is a very good and wonderful idea to consolidate, to reduce the size of the hotel, and we just have to make those decisions based on projections and numbers. So it's looking at what, like we've had 144 cases in the past 28 days, and if you're looking at that number, if all those individuals were living in homes that were not suitable, these individuals would have been in the QFAC, in the isolation facility, right? Because that is the reason why it's there, so that people who are in multi-generational homes are taken over there. So if we have this number of cases in the past 2 weeks, does it show that we know that the trend is coming down, or is it steady, or is it going up? So these are decisions that we have to make on our own side, using the data available, and also looking at projections of what might happen over time. So I think it's a good decision. We talked about it, we worked around it, and I hope and I believe that we'll get to that place soon enough.
All right.
Because what we want is 0 cases. If we don't have cases, we don't need the hotel. That's the truth.
Yeah, but I feel like when we don't have cases, it's going to be like, oh, we need to have it just in case we get cases. I mean, hey.
No. What is going to be is that if we don't have cases, then we're going to have a backup plan in case we have cases. The epidemic hasn't been called off. That is the pandemic. Sorry, the pandemic hasn't been called off. So the success on Guam shouldn't be taken for granted. That is what we need to understand. So people shouldn't take it for granted. The reason why we're not going to have a hotel is when people do the right thing and try to protect others, then we're not going to have a hotel. But if we're having 144 cases in a space of 28 days, then that means people still need to be more vigilant and be more careful, so that we get these 0 cases. we had 0 cases on the 18th. We had 0 on the 24th. We had 0 case on May 2. We had on May 5. We had 0 case on May 9. We had 0 case on May 12. We had 0 case on May 17. So we've had those days that we don't have cases. Then it goes up to 11 cases, 9 cases. So even if you're averaging it, we're still having like 5 cases every day, if you're looking at the numbers here. So we just need to look at the number. I think here the decisions are made by these numbers, because we're looking at those numbers to make the decisions, and those numbers directly shows people's attitude and behavior. Because if we're having 0 cases, then people are doing the right thing. But when we have a 0 case on day 1, and then the following day we have 10 cases, then it actually shows that something is not being done right. And we've tested almost 7,000 people within this period. So we are still doing serious active case finding from the public health side.
Chima, let me ask you, what's your opinion of the 2 military bases instituting a no mask mandate for fully vaccinated individuals?
I think that is on base, right? It's not off base closely, and when they're off base, they still adhere to our own guidances. So there's a balance there, We also know that CDC, came up with that guidance, but on the island, we don't think is right now, looking at the situation that we have here, to adopt that, because it's a recommendation for us to make that choice. So right now, the island, the Department of Public Health and the island is not making that choice until we feel we are right, we're in the right place to make that choice, and then we can. But right now, we're not.
That's so interesting to me, because it's like the island is just the geographics of it. You drive somewhere, you go behind a fence, and all of a sudden you don't have to wear the mask. But then we have you, the chief public health officer, saying, "Oh no, that's not prudent."
It's the dynamics of the island, So to a certain extent, but we actually work closely with them, and we go back and forth, discussing these situations. But if it's like you're not wearing a mask in your home, right? And then you're coming out to the public and you're wearing a mask. So let's put it that way. You're in your home, you take off your mask, but when you're coming out, you protect other people.
Yeah, but isn't there a lot of there's the military personnel who, live on the base, and you might say, oh, that's their home, but then there's a lot of people who work on the base who come out, who make their home out here. So, I'm just wondering, because, we're being told out here that we have to wear the mask, and I'm a total mask wearing guy. I'm not trying to be a devil. I'm just wondering, it's like, we got to wear the mask out here, but you drive somewhere on the same island and you don't have to wear a mask, and it just doesn't make sense to me.
But like you said, it's behind the fence, like someone is not wearing a mask behind the fence, and then he comes out and then he's wearing a mask, So we have to look at it that way too, like they're not going against what we said, So you're not seeing someone walking around in the community without a mask. You're not. If you walk around the island, everybody's wearing a mask. So that's how we look at it.
Whatever happened to the one Guam approach, though? All right. All right, Chima. Thank you. Good luck at your hearing today.
All right. Thank you so much.
We'll see you.
Thanks, Chima.
There you go. Right on.
Thank you, Sabrina. All right.
Okay.